Good day. This is Dr.K Gireesh, physician, neurophysician and neurosurgeon. This is the RNA series number 62. RNA is nothing but random questions in neurology and neurosurgery with answers by Dr. K Gireesh. This is to benefit the practitioners of neuroscience and the medical field and for a lifelong learning and also for the public awareness. In this series, I am addressing the question on what are the features of Grisel syndrome. Grisel syndrome is a non-traumatic atlantoaxial subluxation, that is C1, C2 instability, that occurs secondary to an infection or inflammation in the head and neck region. It is most commonly seen in children following an upper respiratory infection or ENT surgeries. Grisel syndrome is equal to inflammatory atlantoaxial rotatory subluxation without trauma. It involves the abnormal movement between atlas C1 and axis C2 due to the ligamentous laxity caused by the inflammation. It was first described by P. Grisel in 1930 in patients with nasopharyngeal infection who developed torticollis. P. Grisel was a French physician and an otolaryngologist, ENT surgeon, who lived in the early 20th century. He is best known for describing this condition, now called as the Grisel syndrome. In 1930, P. Grisel reported cases of children who developed torticollis, atlantoaxial subluxation, C1-2 instability, after nasopharyngeal infection or ENT procedure, even without trauma. He recognized that infection in the throat could lead to a cervical spine instability, which was a novel observation at that time. The primary infection or the inflammation, like a pharyngitis, tonsillitis, adenoiditis, a retropharyngeal abscess, can produce this. And spread of inflammation to the cervical ligaments occurs through the pharyngovertebral venous plexus, and this causes hyperemia, ligamentous laxity and atlantoaxial disability. The commonest causes are infections, pharyngitis, tonsillitis, otitis media, retropharyngeal abscess, adenoiditis. And after ENT procedures like adenoidectomy, tonsillectomy, mastoid surgery and nasopharyngeal surgery. The typical presentation is of a torticollis, cock-robin position, head tilted to one side, chin rotated to opposite side. Neck pain, restricted neck movements, fever or recent throat infection, and neurological deficits. The diagnosis is usually a clinical suspicion, a child with a recent ENT infection with torticollis. Then imaging is another gold standard, CT scan. It demonstrates a C1, C2 subluxation. MRI shows the ligament inflammation and detects the spinal cord compression. There is a classification, Fielding and Hawkins classification for this torticollis. Type 1, rotatory fixation without anterior displacement. Type 2, rotatory fixation with 3 to 5 mm anterior displacement. Type 3, a rotatory fixation with more than 5 mm displacement, and a type 4 is a rotatory fixation with posterior displacement. The treatment, early cases, most common, conservative management, antibiotics for the infection, anti-inflammatory drugs can be given, muscle relaxants can be given, cervical collar, bed rest, and in moderate cases, cervical traction and immobilization. In severe or the late cases, C1, C2 surgical fusion, but this is rare but required when the neurological deficit or irreducible subluxation or when there is a chronic instability. The complications are a chronic torticollis, spinal cord compression, quadriplegia, which is very rare, persistent neck deformity. An important clinical point which I have to convey is that any child with torticollis after throat infection or ENT surgery should be evaluated for Grisel syndrome. Early diagnosis prevents the permanent atlantoaxial disability. There are lovely references for this, like Pang et al., Atlantoaxial Rotatory Fixation, Journal of Neurosurgery, 2004. Wetzel et al., The Grisel Syndrome, in the Journal of Spine, 1989, a beautiful article. Park W.W. et al., Venous Anatomy and the Pathogenesis of Grisel Syndrome, in the Journal of Neurosurgery, 1984. And Bhattacharya et al., The Grisel Syndrome Review in Otolaryngology, Head and Neck Surgery, 2004. These are some of the references which give details of this particular condition called Grisel syndrome. Thank you. Thank you very much.